Hello and welcome. Today we're taking a deep dive into a common yet often uncomfortable topic, diarrhea. We'll explore what causes it, how it affects your body, and most importantly, what you can do about it. So, what actually causes diarrhea? The etiology is quite diverse. Infections, particularly viral, bacterial, or parasitic infections, are frequent culprits. Think food poisoning or traveler's diarrhea. Certain medications like antibiotics can disrupt the gut's natural balance. Leading to tolerances, such as lactose intolerance, also play a role. Irritable bowel syndrome (IBS), inflammatory bowel disease (IBD) like Crohn's disease and ulcerative colitis, and even stress and anxiety can trigger episodes. Even some artificial sweeteners can contribute to diarrhea in susceptible individuals. Let's delve into the pathophysiology. Essentially, diarrhea occurs when there's an imbalance in the way your intestines handle fluid. Normally, the small intestine absorbs water and electrolytes from digested food. In diarrhea, this process is disrupted. This can happen because of increased intestinal secretions, meaning your gut is releasing too much fluid. Or, it can be due to decreased absorption, the intestines aren't taking up enough fluid. Another mechanism is increased intestinal motility, where food moves too quickly through the digestive tract, leaving little time for water absorption. The specific mechanism varies depending on the underlying cause. Diarrhea is a widespread condition, affecting people of all ages and backgrounds. Incidence is particularly high in developing countries due to factors like poor sanitation and contaminated water supplies. Globally, it's a leading cause of morbidity and mortality, especially in young children. Travelers' diarrhea affects a significant portion of international travelers. While most cases in developed countries are mild and self-limiting, chronic diarrhea can have a significant impact on quality of life. The signs and symptoms of diarrhea are usually quite noticeable. The hallmark, of course, is frequent loose or watery stools. You might also experience abdominal cramping, bloating, and nausea. Urgency, the sudden, intense need to have a bowel movement, is another common symptom. Depending on the cause, you might also have a fever, chills, or blood in your stool. Dehydration is a serious complication, so be aware of symptoms like increased thirst, decreased urination, dizziness, and fatigue. Diagnosing the cause of diarrhea often involves a combination of factors. A thorough medical history, including recent travel, medications, and diet, is crucial. A physical examination helps the doctor assess your overall condition. Stool tests are frequently ordered to identify infections, parasites, or blood. In some cases, especially for chronic diarrhea, blood tests, endoscopy, or colonoscopy may be needed to rule out other conditions like IBD. Diarrhea can be classified in several ways, including acute vs chronic. Acute diarrhea lasts for less than 2 weeks, while chronic diarrhea persists for 4 weeks or longer. Another way to classify diarrhea is based on the underlying mechanism: osmotic diarrhea, secretory diarrhea, inflammatory diarrhea, and motility-related diarrhea. Understanding the type can help guide treatment strategies. Treatment and management of diarrhea primarily focus on rehydration and symptom relief. Oral rehydration solutions, containing water, electrolytes, and sugar, are essential for replacing lost fluids. Over-the-counter medications like loperamide can help slow down bowel movements. Probiotics may help restore the balance of gut bacteria. For more severe cases, especially those caused by infections, antibiotics or other medications might be necessary. Dietary modifications, such as avoiding dairy products or fatty foods, can also be helpful. It is important to consult with a healthcare professional to determine the best course of action for your specific situation. Prevention is key when it comes to diarrhea. Practicing good hygiene, such as frequent hand washing, is crucial. When traveling, be cautious about food and water sources. Drink bottled or boiled water, avoid raw foods, and make sure food is thoroughly cooked. Vaccination against rotavirus is recommended for infants to prevent a common cause of diarrhea. Avoiding foods that you know trigger your diarrhea, such as dairy for those with lactose intolerance, is also an important preventive measure. The prognosis for acute diarrhea is generally excellent, with most cases resolving on their own within a few days. However, chronic diarrhea can be more challenging to manage, requiring ongoing treatment and lifestyle adjustments. Recent research has focused on the role of the gut microbiome in diarrhea and the potential for novel probiotic therapies. Studies are also exploring the use of fecal microbiota transplantation (FMT) for recurrent or refractory diarrhea. Continued research promises to provide even more effective strategies for preventing and managing this common condition.